This is No Hate Radio.
I'm no stranger to the rain. Oh, no. I'm no stranger to the rain.
Hey everyone, thank you for joining us on No Hate Radio. Today on No Hate Radio, we are continuing the theme that we adopted for our Season 2, which is the theme of always to ask in every episode, why and what are we going to do about it as relates to the subject that we're covering in a particular episode. Remember that our goal is always to have civil and objective exchanges of ideas and conversation related to the intersection between law, politics, public policy, and social justice. That's what we'll be doing today, because we do have a guest speaker here today trying to make life better for some people, whether it's individually, whether it's as a group, or whether it's dealing with issues and problems that they may face. We have a guest today who is kind of a dual qualified person. She's a licensed social worker, but also a licensed attorney in the state of Florida. We have the benefit of having Gina Gibbs here with us today, and with that, I would like for her to introduce herself and kind of give some background in terms of who is Gina.
Thank you, Don. So thank you for having me here. Again, my name is Gina Gibbs. I'm a Florida native, graduated from Dunedin High School, and then I left and I came back about 20 years ago. So I've been here longer than I haven't, and I've seen Pinellas change a lot. One of the reasons I came back to Pinellas County was to make a difference here. I had moved primarily to New York City, which is a very liberal city, and has lots of supports and things there that I was missing when I was a young person here in Pinellas. I initially was very, very pleased that when I came back, there seemed to be more supports and more like-minded people here, and that very quickly turned. So now I'm here, and I'm still trying to help folks. My history has started out, I've come from a family of helpers. My families were teachers and other educators primarily, and I'm very proud of that. While I took a different path, I started doing human services and social work. And initially, that for me was in the early 90s, and that was with people who had HIV and AIDS. So I did home health care for people with HIV and AIDS in Alabama. And then I moved to D.C. and did a couple of jobs there. And that was, again, still in HIV AIDS prevention, care, and interventions. And then I moved to New York. And in New York, I, again, continued working in the AIDS community, or people living with HIV and AIDS, and also decided to go to law school and to social work school. I actually went to social work school first and then decided, hey, I really think I want this information. I'm not really sure if I want to be a lawyer, but I want to be able to get this information to be able to do good. And ultimately, that's what ended up happening. I never really practiced law full time, but I've utilized it in different ways in working with the government and trying to do some reform at the local level, as well as informing it in my everyday practices and some pro bono work.
That's outstanding, because I'm always caused to remember or to relate it to my law career, which now is getting long enough it's really beginning to worry me. It's been over 50 years, but the notion of law and the law practice and how people practice at the time of my entry into the profession a long time ago was a pretty straightforward, pretty defined way. You either completed law school and took and passed one or more bar examinations and practiced law, or ran for public office, or both, or served in the judiciary or something of that nature. But the idea that law degrees and licenses to practice law would be used as an adjunct to another profession, at least when I entered the profession many decades ago, was not really a recognized thing. And the other day I took great heart in reading the ABA Journal. I've been a member of the ABA for 50 years. And there's a cover story about what they call legal rebels. These are people who have developed a law career, maybe even practiced law for some period of time, and now either combine it or use it only as an aid or an adjunct to something else. And I've learned that your combination of being a social worker, particularly, I would call it, I don't know what the state definition is, but clinical social work, where you're actually involved one-on-one with trying to help people in their individual life. And those people may be, at least at one time, certainly were, not only a marginalized class, but a targeted class for some lengthy period of time. So I just want to say that I congratulate you for being one of the people who learned how to combine an understanding and appreciation, the facts, the way of thinking that you get with the process of becoming a lawyer, and transitioning that, or not only transitioning it, but operating it in an adjunct way with a social services career. So talk to us about you've done it in several areas. You mentioned that New York and D.C., Alabama, and I'm not actually trying to make a particular joke here, but Alabama and D.C. aren't really, that doesn't seem particularly compatible. So you've been in some, very widely varied environments in trying to do what you do. So can you kind of give us a little history on how that worked and how that made you adjust what you did?
Well, I grew up in Florida, and I feel like in Florida as a queer child, young adult, I fled from here as quick as I could. And for me, that led me to North Carolina, that bastion of liberalism it was, especially during the Jesse Helms years. I was all of 17 when I left, didn't know what I was getting into, that it was really going into a much more difficult political and cultural state at the time. But from there, my undergraduate was really preparing me to be a helper, to be, human services was what I studied, and social work was really, what I wanted to do, and I knew that leaving there. So AmeriCorps was starting, and that's how I actually ended up in Alabama and then D.C. So I went to Birmingham, Alabama for a year of AmeriCorps. If you're not familiar, that's like the rather than the International Peace Corps, it's a domestic corps that helps. And so this program was at Birmingham AIDS Outreach, and it helped people who were living with HIV and AIDS doing home health care. So I was certified as a CNA, home health assistant. And also they had a youth program and other community programs. And that really got me interested in helping people more. And so I decided to do a second year of AmeriCorps, and that led me to D.C., to National AIDS Fund. And there I worked at an organization that was working specifically with sexual minority youth. That was, the SMILE was what Sexual Minority Youth Assistance League. And so they had a drop-in center and services and counseling for youth who are questioning or who are identified already as lesbian, gay, bisexual, or transgender, or questioning. And I also worked at an organization that did street outreach to people who were engaged in sex work in D.C., and that was HIPS, both of those organizations are still wonderful organizations and existing, all three of those, Birmingham AIDS Outreach, SMILE, and HIPS. And that really just gave me the idea that I'd found my calling, that I wanted to work with young people primarily, and I wanted to work with marginalized populations, the underrepresented, under-resourced, overburdened populations, to try to help them. And since HIV/AIDS was such a devastating disease to the community, the LGBT community, the reason I really fell into that was to help. But I also was helped so much by finding a community in that sense. Even in the South, even in Alabama, during the Ellen episode that was banned, it was in Alabama. We were able to turn that into a fundraiser in that community. Lots of different things you can turn and try to make them positive for community, so that you can find each other and find that support and love from each other, even when the outside community is not.
That's excellent. And yes, reaching back to one of your earlier comments, I am very familiar with AmeriCorps because initially I think it was called VISTA, Volunteers in Service to America, and then became AmeriCorps. But it was back when I was a college student, it was brought to the campuses as an alternative. You can either do 2 years with the Peace Corps or 1 year with what was then Vista, later AmeriCorps. And I think you said you wound up doing 2. You went ahead and did your year, but re-upped and went to D.C. Excellent public service. It's the kind of public service that addresses I guess I hate to overuse words of hyperbole, but it addresses what was understated as an urgent need at the outset. And I don't know what years you started this, but I know that at the outset of what became the AIDS epidemic, and I was in Texas practicing law at that time, and there was no treatment. As you know, it was it was a death sentence for so many people, and with it, a lot of political exclusion, a lot of worse than political, physical exclusion, and other kinds of things on notions that were not true medically, but people seemed to buy into. So you entered into a career that's, at least from a historical viewpoint, again, I don't know what year you entered it, Jenna, but at least from a historical viewpoint, from an old guy like me, it would have been a pretty rocky road, a pretty rough career to venture into, because you're not only trying to help people, but you're trying to fend off a lot of, I would call it, unjustified hate and other matters. Did you find that to be a different environment in any part of the country as you traveled around, New York, D.C., Alabama, Florida? Did you find that you had more or less pushback, more or less support in any given area, or was it pretty much the same everywhere?
I think in all of the places that I worked, communities came together, and not necessarily all. I say communities because there's so many. It's not just one, but communities of faith came together and supported instead of just hated. Yes, there was that other side. People who had lost their families through disconnection because of coming out as gay or coming out as HIV positive, or both. That other people stepped up and took those roles as caregiver, as parent, as loved one, as witness to what was happening. I was lucky or unlucky or whatever. I was able to, it was in the system long enough, or the care system, that I saw not only the time when we didn't have the medications that made it more of a chronic illness, to the point where we eventually did. So I was able to see both sides, and so that was somewhat uplifting to be able to see that, hey, there is, even after all of this activism that had to happen in the community, to make our electeds really pay attention and to make other people care about somebody who had been so marginalized and still for a large part is, that the medical community continued to work on things eventually and got the funding and got the resources that it is now considered more of a chronic condition, although it's still very much impacting young men of color who are having sex with other men. So there still is that marginalization that's happening and the underfocus. So when I came back to Pinellas, by the time I came back to Pinellas County, to Florida, we still have very high rates of HIV, again, among young men of color who have sex with other men, what we would usually call gay men or bisexual men. It's not talked about as much here. It wasn't talked about when I left, and it seems like when I came back, it's not as talked about. And now I think partially it's because of the chronicness of it versus the death sentence of it, but it's still something that's very much inhabiting my thoughts of we should be helping more people to live without HIV, because there are reasons why those communities are still getting HIV, and it is the marginalization, the exclusion, the under-resourced, and hate that goes towards young men of color who are gay or bisexual.
Of course, I think in terms of law and politics, my wife will tell you that I sleep in terms of law and politics. But here's the observation I have for that, and you've been ground zero. You've been boots on the ground on the political environment when you were trying to have been through your career, trying to work with a group of people who were and are still marginalized people. I think the leadership in at a given time has everything to do with how we deal with big problems. And yet the people who deal with it on a daily basis are folks like you who are out there talking to the actual people who are living with this circumstance, dealing with them, trying to help them. But it occurs to me that we have had, and in our current times it doesn't seem too common, but we've had both sides of the political aisle join together, not during their power period, but later when George W. Bush and Bill Clinton joined together to create a foundation specifically to try and fight AIDS, particularly in Africa and other continents. It gave me some heart, whether it was successful or is or not, I don't know, but it gave me some reason to be encouraged that they kind of got above their political raising, as it were, and joined together for that. So I'd like to get your take on that.
Well, I have hope in humanity that we will be able to elect and keep people in power that will make better choices that are about human needs rather than their own needs, or rather about looking at USA first in the sense of what is social good. And I think a lot of the conversation actually ends up being about definitions. What is good and what is good for people? What people are we talking about and what is the value of good? It's a very value-based thing. So as I look at as a social worker, my ethical guidelines are to promote to end discrimination and to promote social justice. I think that a lot of people who are not doing that in my definition think they are. People who are in power, who are making decisions that I think are wholeheartedly going to harm people, don't seem to care about who those people are, whether they're in the U.S. and whether they should be here or not is one question right now in our time. But I think it really comes down to we just gloss over what we mean with our words.
We don't do political change slow, apparently, in America anymore. The 1960s, for those of us who were around and were cognizant of what was going on, thought that we were in a whirlwind wind tunnel in the 60s with the civil rights movement, the women's equality movement, culminating, what was it, in 71 or 72, Stonewall, and just so many things that happened in a 10 to 12 year period there. And yet now, as I look back on that period and I see what's occurring currently in our environment, it causes me to remember something a friend of mine said one time: "You ain't seen nothing yet." So I think that's maybe what we're aware of right now. My particular piece of, I'd call it personal involvement, centers around one point you mentioned, which people, do we have even right to be here, centers around immigration. And immigration, I believe, to be a cornerstone in all this, because it's generally centered on race or differences, or that the perception is us versus them and all of that. So I see it as my particular, let's call it, to use that phrase, my boots on the ground issue. But it would involve the population you work with either before or today. You said now you're more into the general population. Well, the general population of people in our country, in our county, in our city, wherever you want to go, that you would practice with, you have housing issues, you have socioeconomic status issues, you have education, you have so many of these. It's like an octopus of problems that are, some of them winding up over each other. And to my oversimplistic, probable way of thinking, and I said it in connection with the ministries of this church, is you can't be all things to all people. You have to pick a lane. And it seems like you've picked a lane and stayed in it. So I would like to, like today, you said you're working more with the general population as a social worker. How would you define the general population that you're working with today?
Well, I left the school system. I was a school social worker most recently for the last 5 or so years, and I started private practice. And my office is actually in a counseling suite here at Allendale. And so when I say general population, I'm not I'm in a position where I am not just working with youth, students, and their families, or in that system that has its drawbacks and its wonderful positive things as well. But I needed to do that for myself. So now I work with adults and families and children, individuals and couples, and there's a variety of different ways you can encapsulate that. But I have not found my niche per se. Like, I'm not just working with youth, or I'm not just working with LGBT folks. But I definitely think that there is with my background and my experience, I think there definitely is a belief that that's going to be probably more of my larger group of helping people is going to be LGBT folk and youth, because that's what I have really worked. But I'm a human, and I'm trained to work with all people. Not
Sure.
And so I want to help as many people as I can. My practice is still growing.
Do you find that the political environment that we're in, not only now but have been for at least a year, I mean, the intense, vicious kind of political debate and massive political change and all that, do you find that's had an effect on the people that you work with in your practice today? Oh,
absolutely. Politics enters therapy all the time, and politics is its own unique stress, and I think a large component of that is that it is so ever present in our society in the U.S. right now, and that it is really uncertainty, in particular in these times, that it's uncertainty. And so that stress definitely enters the therapeutic relationship in talking, because we're talking about stress. Stress has a huge impact on really what all therapy is, whatever that stress is. We don't generally go into therapy because, hey, life is great, right? There's usually some stressor or some kind of maintenance that needs to happen for us to be able to manage all of the stress. And so stress, whether it's unique political stress or just regular life events, really have a physical response. We're humans, so our nervous system goes into a fight or flight, and that fight or flight really has an impact on our whole body. It starts off the cortisol and adrenaline, all of that, and that can have a huge impact on our physical health, our mental health, all of that. And so politics isn't going anywhere, particularly in the United States. That uncertainty around politics is not going anywhere. So part of what I try to do when we're talking about stress is generally saying, how can we get your flight or fight response, your nervous system, in control? We need to deactivate that in regards to that. And so some ways to do that is, one, to acknowledge that it's uncertain. Uncertainty, as much as we try to control things, we never can. So coming to grips or reality that uncertainty is always going to be there. So, hope for the best, plan for the worst, but know that uncertainty will always be there. And get engaged. That's the biggest thing, particularly in this political world, is to try to deactivate your nervous system, that fight or flight, and by engaging in other things. So finding somewhere that's safe. Whether that's a faith community or a community group, your family. Put boundaries if your family's not that safe space, to say, I'm not okay talking about that, right? But also having compassion and patience with other people to understand that, again, in my opinion, a lot of that is about definitions. We may have the same underlying belief, but we think it should be interpreted and acted out differently. So be patient with other people. And the biggest thing is take care of our body, right? So making sure you're taking care of your body, meaning moving your body, hydrating well, eating well, sleeping well. Sleep hygiene is a really big thing. But also the consumption of news media is such a 24-hour cycle in the last 20 or 30 years and it's become so polarized as well in political and propaganda versus actual journalism. You also want to make sure you're controlling your media exposure. So stop the doom scrolling, always looking through the news, whether it's on social media or otherwise. Limit that. No, I'm not saying don't look at the news, but limit it. Whether that means you may have to set a timer because people get time blindness and they just forget. Limit who also you're paying attention to. Do you want to look at something that everything that comes out of Donald Trump's mouth, sorry to say his name, is breaking news, or we are looking at something that's journalism that's saying this may happen, because a lot of things that our current administration's doing may not become true. It's that uncertainty. The courts may block it. He may be saying things and may realize that's not going to happen. He may just change his mind, whatever. The uncertainty of that. So look at who you're looking at. Try journalism over propaganda, and maybe a summary versus the breaking news kind of thing is really important, so that you're getting involved in something. So find that local organization that has the topic that you're interested in. There's so much out there. Obviously, think globally, but try to act locally. Learn about something, donate money, donate your time. And that can be your time at your house. That can be a time with an organization. That can be time on the street protesting, but doing something to get out of your thought process and the rumination about the uncertainty and all the failures that have happened. So also try to think about in the past, how have you handled those stressful situations? What has helped you? Try to repeat the things that have helped you. And then we know that certain things don't help you. Drugs, alcohol, tobacco, ruminating about negative things, all the reverse of the other things I've said, being sedentary, all those, not good for you, right? So try to make good choices, move your body, and move your body out of the physical response of fight or flight, that nervous system, so that we can try to get in a healthier space. And one thing that I think I won't, since I work with kids, and is always be mindful that kids are listening to you and they're seeing you. So be mindful that when they're around you, even if they're not paying attention, we think they never pay attention, never hear you, they are hearing you, they are seeing you. So be mindful of your own responses with words and emotion and our actions, because they're going to parrot that. They're going to take that in and say, oh, that's okay to act that way. Rather, try to teach them to be mindful. And the way to do that is to start with, well, what do they know, right? What do they want to know? Is age appropriate? So what do they know? What are they concerned about? And then respond to that lovingly, age-appropriate response that's hopefully going to be raising a child or young adult to be a caring young adult. And then always, always, always try to lead with love and make sure they understand that no matter what is happening around them, whether it's immigration potentially coming to your school or your church, or people saying you don't have the right to exist in this country, or you don't have dignity because of some identity, or whatever it may be, let them know you have unwavering, unconditional love for them. No matter what somebody else says about you, you don't have to accept that. You are loved.
I like that. And that's excellent. That's excellent philosophy and good advice. And I would suggest that if anybody is listening to this today and trying to take something away from it, that is some of the soundest advice or information you can, and which is, I'll phrase it a different way. It's the same thing. It's your words being said a different way. Is try to get out of your own head and don't let other ideas, negative ideas, in there. And I think many of us struggle. So many people that I know, and I know well, are in a state of off balance, confusion, particularly people that are in the what is referred to as a marginalized class, for whatever reason they're in that marginalized class. And there's an aura of hopelessness that is more or less getting pervasive among some people that I know. And it seems to me that what you're saying there is, this is what you're going to do about it. This isn't the why are we here. I think we have some ideas on why we're here. But the what are you going to do about it? And I don't mean to misstate or wrongly state what you're the message you were delivering, but it has to do with what you're going to do about it. Is first you're going to take care of yourself, and you're going to decide that you're worthwhile, and you're going to not let other people drive your thought process, either by constant media. You use the term doom scrolling. I love that. but to care about some issue and try very hard, at least, to gather some hope.
Absolutely. I think there is hope. And one of the ways I find hope is this isn't new. This has been going on. So even when you look at what you referred to historical, yes, a lot of that is still contemporary when we talk about racial rights, and when we look at women's rights and Native American rights and LGBT rights, all those things, they didn't happen overnight. They're still contemporary. Like now, things need to improve, and we're going backwards in some way. But I find that there is hope, and one of the big things to find hope from is to know that when fascism and authoritarianism or just unkindness has occurred, we have a playbook now. There is a resistance that has popped up in all of the communities and is still popping up now. And so I have hope that we're going to continue to listen to the people who have already experienced this, whether they're still on this planet or not. We have the playbook, look at it, but also look at the people who are here and who have for years been saying, hey, this isn't right. This is unkindness. George Floyd, that event happening, that murder happening, in my opinion, on camera, really, among many others, brought to light what many people had already been very loudly saying, this has been here, this is continuing to happen, believe us. So I have hope that, not that bad things have to keep to happen, but that we'll learn how to get that resilience and resistance more wrapped up so that we're taking the lead rather than always responding.
Excellent. As we start to wrap up here today, this has been a very meaningful, and I think in it that you've brought some insights here, Jenna, and I truly appreciate you being here and sharing with us the career path that you've had and how you deal with and how you handle what can be very destructive things in around people's lives. I know there's essentially two ways. I think two. There's others may argue that there's more, but I think there's two ways to look at kind of tragic, devastating events or very, very threatening events. Again, I have to fall back on what I understand the most because I'm intimately familiar with borderland from Brownsville, Texas, out to Lordsburg, New Mexico, and other places, is that there's a culture and a lifestyle there that people who don't live on it don't understand and can't ever understand. But the group that we just interviewed Kate Prevera about, called Witness at the Border, one of the events that is witnessed there is a woman obviously pregnant, some 6 months or more pregnant with a small child, attempting to get just basic food and water on the north side of the Rio Grande, and being turned away, and knowing when you witness that you're probably witnessing maybe the last day of that person's life, maybe the child too. And you can look at that with hopelessness, say, here I am watching this and there's nothing I can do. Or you can decide what you can do, either micro or macro. Those are my favorite terms for that. Either micro, either I can do something for her, that person, or I can do something for people in that situation. But whichever one it is, it certainly gets you out of your own head. It certainly makes you get rid of the helplessness, doesn't it? And it makes you take action. So I really, really, truly appreciate your insight and what you told us today. This is information that it falls in the general category I like to call coping. How do we deal with the reality that we have here? Our theme song for this podcast, called No Stranger to the Rain, kind of describes a lot of our life circumstances today. A lot of us are no stranger to the rain, and some greatly more than others. But in that song is a phrase, I'm going to beg, steal, or borrow a little sunshine. And I think that's an underlying message today on No Hate Radio. let's get out of our own heads. Let's beg, steal, or borrow a little sunshine. Let's get some help from our friends when we need it, and let's try to look forward a little bit. If you're new to No Hate Radio, thank you for joining. If you're a repeat listener, please know that we have a website, nohateradio.com, and you can pick all of our episodes up. And it also has a box on the website where you can send an email. You can suggest, a subject or someone like Gina that you'd like to hear on No Hate Radio, someone that or a topic that you think certainly needs to be discussed. Then we will try and act on that. We also have a phone line that will get you into a recorded message, and you can say what you maybe don't want to bother to email. Just call us, 442-4-NO-HATE-RADIO. And when you do that, leave us that message. Tell us what you would have told us in an email. Give us those same suggestions, because what we're trying to do with No Hate Radio, number one, no hate. Number two is have a source whereby people can obtain hope, can get hope, and can deal with why and what are we going to do about it. Gina, final words?
Yeah, I don't want to end without saying thank you, but I also want to make sure that people have resources. Again, my name is Gina Gibbs. I am a LCSW. If you want to find me, you can find me on Psychology Today. If you want help locally, 211. Just pick up the phone and dial 211, and that'll get you resources in your community. If you are feeling suicidal or need assistance with somebody who is being suicidal, obviously 911 or the hospital, but there is a suicide hotline that is 24/7, and nationally it's 988. That is a new number in the last year, 988, if you are needing help with suicide, individual or yourself. Take care.
Thank you very much, Jen. That piece of information is wonderful, and I appreciate that. And as we wind up our episode today, we're going to continue with our theme of talking to people who are either individually or as a group or as an organization trying to do something in the context of today's rather difficult world to make life better. We're going to try and make things better from the margins instead of to the margins on No Hate Radio. And with that, this is No Hate Radio.